Now, returning to the government's so-called green list outlining the countries deemed safe for Irish people to travel to and from, which is due to be published on Monday. We're joined now from our Cork studio by Simon Coveney, the Minister for Foreign Affairs and Defence. Minister, thanks indeed for joining us this evening. First of all, looking at the numbers creeping back up, we're at 34 new confirmed cases this evening. Should you be considering a green list at all?
Well, I think that's a matter we'll be discussing in Cabinet again on Monday. The one thing I will say to you is that we will certainly proceed with caution here, taking advice from the public health experts, but also trying to recognise the fact that there are countries, particularly within the European Union, that have very similar numbers to Ireland, that don't represent a higher risk level than are present here in Ireland. And so we're considering putting those countries on a green list, which would mean that if people are travelling from those countries to Ireland, we wouldn't be asking them to self-quarantine and to restrict their movement. Really, that's the only change that we're talking about here, to try to recognise the fact that not all countries have the same risk levels. And so by applying a data-based approach in terms of looking at the epidemiological data that's there, in terms of the number of positive tests in countries over the last 14 days, and then making decisions on the basis of that data to ensure that we're keeping people safe. But to reassure people, the government is not going to rush into something here. International travel does represent a very significant risk to the reintroduction of this virus back into Ireland, when the Irish public have done such a good job at actually trying to contain the spread of this virus. So we will be very cautious.
Sorry, Minister, so why are you using, as you say there, the number of cases per 100,000 of population over the last 14 days? Why are you using that criteria to define which countries are deemed to be safe?
Well, first of all, that's the criteria that the European Union has used in terms of opening up international travel to third countries outside of the European Union. So we are taking that approach, but we will be applying a much more conservative approach in terms of the actual number to a green list from an Irish perspective. We want to ensure that we are not opening up countries to travel without restriction unless they have a very similar risk level to Ireland. Currently, our number in relation to the number per 100,000 that have tested positive over the last 14 days is in and around 4, which is a very low number in a European context. So, as I say, this will be coming to Cabinet on Monday. We'll make a collective government decision with all of the advice that's there from NPHET, as well as from EU public health experts, to make a responsible decision in relation to a green list.
So sorry, there's a little delay on the line, Minister. I apologise for talking over you. But what countries do you think won't be on that list based on that number of 4?
Well, look, I think that will become self-evident when we start to look at the numbers that have tested positive per 100,000 over the last 14 days in different countries. Those numbers, by the way, are available on EU websites at the moment. We have to be sure that we can rely on the information as well, and that we have confidence that it's accurate.
You had mentioned the United States and the UK earlier.
Well, I was asked the question earlier when I was on a radio station. I was asked, do I think that the United States will qualify in terms of the green list? And I said I felt that was very, very unlikely, given the extent of the positive tests that we're seeing, unfortunately and tragically, in the United States right now. But I don't think it's helpful for me to start naming countries now. This will be a decision made by government collectively on Monday. We will proceed with caution and make decisions on the basis of the most up-to-date data that we have from our public health experts, and make decisions accordingly, as we always have done, in relation to trying to keep Irish people safe.
Does that mean that England, Wales and Scotland may be on the green list?
Well, look, as I say, I don't think it's helpful for me to be naming countries. I responded to to a question that I was asked earlier, and for me to start naming countries now, I think is unhelpful. But what I would say is that we won't be making decisions on the basis of politics. We will be making decisions on the basis of epidemiological data and public health advice. That is the only responsible way, in our view, to do this. We know that the numbers have been increasing in Ireland recently, which is a real concern. That is why I think the vast majority of people are planning to stay at home this summer, to take their holidays at home, which is what I think they should be doing. But we also have to try to recognise the reality that at some point we will have to try to facilitate gradually the reopening of international travel to maintain connectivity from an Irish perspective. We have to do that in a way that is as safe as possible. And we think a green list approach, whereby we are not applying the kind of restrictions to countries that have similar risk levels to Ireland, makes sense. And that is hopefully what we will be able to do as a government on Monday. But of course, the decision is not made yet. And we need all of the data in front of us to make an informed decision. And there will, as you would expect, be a lot of conversations preparing for that meeting over the weekend.